Hello, my name is Leonie. I am one of the diabetes dietitians, and today I'm going to discuss the dietary advice for gestational diabetes.
Overall, it is important for you to aim for a healthy, balanced diet to keep you healthy and to help your baby to grow and develop. Depending on your individual blood glucose levels, you may need to make some dietary changes to help keep your glucose levels in target. Carbohydrates are an important part of your diet and they provide us with energy. Carbohydrates are broken down in the body into glucose, and so the amount and the type of carbohydrate you eat will directly affect your blood glucose levels. There are two main sources of carbohydrates: sugars, for instance that found in sweets, desserts and biscuits, as well as natural sugars found in fruit and milk, and starchy carbohydrates such as bread, pasta, rice, potatoes and cereals. In today's session, we will look at some dietary changes you may wish to try. Please note, we do not want you to exclude all carbohydrates from your diet. If you are struggling to control your glucose levels, please get in touch with your diabetes midwife. In today's session, we will also discuss drinks, including the caffeine recommendations during pregnancy, and we will also touch on food safety messages for pregnancy and discuss vitamin supplements.
So what you can see here is a picture of the Eatwell guide. The Eatwell guide is a guide of what a healthy, balanced diet would look like. So it's not one meal, it's your whole diet. And as you can see, there's lots of different food groups, and all of these are important to keep you and your baby healthy. And so we'll just spend some time discussing each food group in turn.
If you are getting high blood glucose levels 1 hour after meals, the first thing to focus on is how much sugar is in your diet. Could you perhaps reduce your sugar intake from biscuits, sweets, cakes, chocolate and desserts if you eat them? Although these foods are tasty, they tend not to be very nutritious, and so cutting back on these items will be an effective way to help control your blood glucose levels. I would also encourage you to think about your drinks. If you tend to drink sugary drinks such as non-diet fizzy drinks, fruit juices, smoothies or milkshakes, it's definitely worth making changes to only have sugar-free drinks during your pregnancy. Next, let's focus on the starchy carbohydrate foods. Starchy carbohydrate foods provide us with energy, and some versions can be high in fibre. Fibre is important as it can help to support healthy digestion and can help to make you feel full for longer. Particularly the whole grain versions are a good source of vitamins and minerals. As mentioned before, starchy carbohydrate foods are broken down into glucose. Therefore, if you are getting high blood glucose readings 1 hour after meals, it's worth reflecting on your carbohydrate portion size. As a guide, a sensible amount of carbohydrate would be approximately a quarter of your dinner plate or a fist-sized portion. The glycemic index is a ranking system of how quickly carbohydrate foods make your blood glucose levels rise after eating them. Carbohydrates which are digested quickly and cause a quick rise in your blood glucose are called high glycemic index or high GI food. On the other hand, low glycemic index carbohydrates, sometimes called slow release carbs, cause your blood glucose to rise more slowly. It's worth trying to choose the more low glycemic index versions, since these tend to help to keep your blood glucose levels more in target after eating. Here are some examples of swaps you could make. Rather than having white or plain brown bread, could you swap to a seeded, granary, sourdough or rye bread? If you like to eat rice, could you opt for the brown, basmati or long grain versions? And concerning potatoes, could you perhaps keep the skins on new potatoes or try sweet potatoes? You may find it helpful to keep a food diary to help you learn which foods you tolerate best and which portions help to keep your glucose levels in target. It's worth noting that certain starchy carbohydrates, such as cereals, may also have quite a bit of sugar added in. Looking at nutritional labels can help you to make the best choices. Plain porridge, for instance, will be lower in sugar than certain flavoured porridge sachets or instant pots. If you like to sweeten it, perhaps try using sweeteners rather than honey, sugar, or regular syrups. The next section I want to talk about is the green section, which is the fruit and vegetable section. As you all know, these are really healthy and essential for a healthy, balanced diet. They provide vitamins, minerals, fibre, and also a little fluid. And so we really recommend that you include these in your diet, overall aiming for 5 portions daily. Salad and vegetables are low in carbohydrate and will not increase your blood glucose levels, so make useful snacks or something to help bulk out your meals more. Fruit, on the other hand, will impact your glucose levels, and so we do advise you to be mindful of your portions. 2 to 3 portions of fruit per day is part of a healthy diet, and 1 portion is 80 grams. A handy way to gauge a portion would be what fits into a cupped hand, such as 1 orange, 1 apple, or 2 plums.
Ideally, we would also say to space out your fruit rather than having one big fruit salad with lots of fruit, which could impact your glucose levels quite significantly, is to try and space it out over the course of the day.
All fruit contains some sugar, however the ones which are a little bit lower are cherries or berries, so for instance raspberries, blueberries, strawberries or blackberries.
Dried fruit is also something just to mention here. Dried fruit, because it's concentrated, will drive up your glucose levels quite significantly if you have it in larger portions. So again, just being a bit careful with the portion, and what we would recommend as a portion of dried fruit would be about a tablespoon.
The next section we'll focus on is the protein section. Protein is essential for your body to help with maintaining muscle strength and is used for making new cells, which is particularly important during pregnancy. Protein foods can also provide important nutrients such as zinc and B vitamins, as well as iron. This is worth noting since pregnancy is a time when some people are more at risk of anemia. Some examples of good sources of protein include meat, fish, eggs, beans, peas, chickpeas, lentils and nuts, and tofu. During your pregnancy, you should avoid eating liver and liver products such as pate, raw or undercooked meats, and certain types of fish. When thinking about your glucose levels, it's worth knowing that protein does not increase your blood glucose. You may therefore find it helpful to use protein foods such as nuts as a snack. If you're wondering how much protein to include at meal times, a good guide is to aim for about 1/4 of your dinner plate. As mentioned before, another 1/4 is recommended as carbohydrates, and then lastly, half of your plate would ideally be made up with vegetables or salad.
When choosing your protein foods, it's still good to keep in mind your heart health. So what we would recommend is to try to go for the unsaturated fat versions. So for example, rather than having lots of greasy bacon, could you maybe remove the fat off the bacon? Or if you're buying mince, maybe buying the lower fat versions and removing the skin off chicken.
The next section is the dairy section, which includes the likes of milk or dairy-free alternatives, yogurt and cheese. These foods and drinks provide calcium, which is essential for your bones to stay strong, but also for the baby's bones to develop. There are some cheeses and other dairy products that you should avoid during pregnancy, as they may make you ill or could be harmful to your baby. Please refer to the NHS website on food to avoid during pregnancy if you need more information, or ask your midwife or dietitian. Cheese is carbohydrate-free and so will not increase your blood glucose level. However, milk and yogurts contain a little bit of natural sugar, though these can still be included as part of a healthy diet. If you find that you are drinking a lot of milk due to, for example, heartburn, please speak to your midwife about suitable treatment options. As a guide, a good daily intake of dairy or alternative dairy-free products is 3 servings per day. 1 serving is, for example, 200 millilitres of milk, a small pot of yogurt, or a small matchbox-sized piece of cheese. Please remember to check the food labels on yogurts to help you choose the lower sugar versions, since some manufacturers may add in additional sugar. So
moving on, we'll talk a little bit about snacks. You don't have to snack, but if you like to snack on things in between your meals, here are a few options. So here are some savory snack ideas. You could try some plain nuts, cold meats such as ham or chicken skewers, some cheese, maybe some veggie sticks with some dips. So for example, carrots, peppers, celery with hummus. How about some cherry tomatoes or a boiled egg? You could try a small amount of plain popcorn or some spicy roasted chickpeas. If you like to snack on sweet things, you could perhaps try a low sugar yogurt or a portion of fruit, as we've mentioned earlier. If you like chocolate, why don't you try the dark chocolate, which is a little bit lower in sugar and more intense, so you might not need as much of it. Online, you can probably find lots of recipes for some home baking, which is a little bit lower in sugar, such as things like low sugar cheesecakes or trifles. One of the frequently asked questions is about breakfast and what are the best choices. So what I would say is, again, taking it on an individual level, is see what your glucose levels are doing. If your glucose levels are over target 1 hour after breakfast, the first thing I would say is have a think about how much sugar is in your breakfast. So for example, if you're having the sugary juices or jams, honey, sugary cereal, could you maybe swap those for lower sugar alternatives?
If this doesn't work and you continue to get high readings an hour after breakfast, it might be worth trying a higher protein breakfast. For instance, could you try eggs, mushroom, tomatoes, and maybe avocado on a slice of whole grain or sourdough bread? Alternatively, how about a plain yogurt with berries, nuts, and seeds?
Next, we'll talk a little bit about drinks. So obviously, it's really important to keep hydrated during your pregnancy, and we'd recommend that you keep away from sugary drinks. Things you might want to opt for would be things like plain water or flavored water if it's sugar-free, tea or coffee without sugar, but you can use sweeteners if you like. Drinks to be really careful with and ideally avoid would be things like non-diet fizzy drinks, energy drinks, which can also be really high in caffeine, things like smoothies and fruit juices, as we've said, or things like non-sugar-free squash, so things like high juices, which still can have a lot of sugar in them. Another thing to note is that some probiotic drinks can be really high in sugar, but you can find lower sugar alternatives if you like to use them. Another important thing to remember is to limit your caffeine intake during your pregnancy, and the recommended limit is 200 milligrams a day. Here are some examples of drinks and their caffeine content. For example, a mug of instant coffee is the equivalent of about 100 milligrams of caffeine. A mug of tea would be 75 milligrams of caffeine, and a can of cola about 40 milligrams of caffeine. It is recommended that you do not drink any alcohol during your pregnancy. Another frequently asked question that we get is, what about special occasions and eating out? So things like going for a meal or having a baby shower. And so at this point, we obviously want you to enjoy yourself. So maybe have a chat with your midwife or your dietitian about some of the best options of how to deal with these occasions. Ultimately, what we would say is still try to stick with a healthy, balanced diet, and maybe just be mindful of your carbohydrate portions when eating out. For example, if you would go for a meal and you might have something like the rice and the chips and the naan bread and the poppadoms, maybe just go for one source of carbohydrate rather than lots of carbohydrates all at once. Next, let's talk a little bit about vitamin and mineral supplements. So in line with the UK government guidance, we advise anyone who's pregnant or breastfeeding to take 10 micrograms of vitamin D between October and March. This is because the body produces vitamin D directly from the sunlight on the skin, and between October and early March, the sun is not strong enough for the body to make enough vitamin D. However, there are some people who are at a higher risk of vitamin D deficiency, and so the recommendation is for those people to take vitamin D all year round. For example, people who have darker skin, such as people of African Caribbean, or South Asian ethnicity, or who have little or no sun exposure because they are often indoors or usually wear clothes that cover up most of their skin when outdoors. You might be eligible for free Healthy Start vitamins, so please speak to your midwife about this. It is recommended that you avoid taking cod liver oil or any supplements containing vitamin A during your pregnancy. If you've had bariatric surgery in the past, please contact your bariatric surgery unit for a one-to-one conversation about your vitamin and mineral supplements. We recommend that everybody takes a folic acid supplement for at least the first 12 weeks during pregnancy. Please speak to your midwife so that you can ensure that you are on the right dose for you, as the recommended dose does vary from person to person. Most foods and drinks are safe within pregnancy, but there are some things that you should be careful with or avoid. Have a look at the NHS website for more information on that. Thank you for joining me today, and I hope that's been useful for you. Please do speak to your midwife or the dietitian in clinic if you have any further questions.